I started looking at patients holistically about 20 years ago after treating my father, who was my first holistically treated patient. And I found that my father, who had a 25-year history of heart disease and continual angina and seeing all the best doctors out there, was on 10 different medications. When I looked at him holistically, he had an unrecognized thyroid problem. And when I just got his thyroid working better, his 25-year history of angina went away. He felt better, he looked better, and acted better. And I started looking at every patient from that moment on for hormonal and thyroid problems. And ultimately, I came to find so many patients with thyroid problems. I started searching for an underlying cause of why are so many patients having thyroid problems. And about 12 years ago, I came to that. I did a study of iodine, and when I started looking at my patients and their iodine levels, I found that over 95% were significantly low in iodine. And when I started rectifying this with using the right kind of iodine, these patients started to get better from a variety of problems, including thyroid problems and breast problems and ovarian, uterine, prostate problems, and we'll get into all that discussion. But that's how I started, and now I've been treating people with iodine for over a dozen years and seeing the great results with it. And the power structure did know about this, and that's why they iodized salt in the 1920s to prevent the goiter epidemic that was occurring. And the interesting thing was, after they, the iodization of salt was hailed as one of the first public health miracles in the United States government, and it was. It really effectively treated a problem that was occurring at epidemic rates. It treated it cheaply. It treated it safely. The interest for iodine waned after that because iodine's not a patentable substance, and Big Pharma started to make inroads after World War II. And really, they were only interested in patentable substances, and the powers that be thought that the goiter epidemic was cured with the iodization of salts, which just wasn't the case. And then things got worse in the 1970s. When radioactive iodine began to be used in medicine, radioactive iodine would only work if people were iodine deficient. It doesn't work if the iodine receptors are saturated with iodine, because the radioactive iodine just passes through and doesn't bind to anything. So the powers that be mandated that the flour products have iodine removed from them, which used to be in all the flour products, and put bromine in them, which is a toxic halogen, and it's a competitive inhibitor of iodine. And that's what really started driving the iodine epidemic we're seeing, 40 years later now. And that's why I think we're seeing so many more thyroid problems and breast problems and so on and so on.
Iodine is an essential element for our body. If we don't have enough iodine, we won't live. It's concentrated in the glandular tissue of the body. And iodine's main job in the glandular tissue is to maintain the normal architecture of the glands. When I say the glandular tissue, I refer to the breast, the ovaries, uterus, thyroid, prostate. What are we having problems with in our country right now? Glandular problems. We have 1 in 7 women with breast cancer, 1 in 3 men with prostate cancer. We have epidemic increases of ovarian and uterine problems. And certainly we have epidemic increases of all the thyroid problems, autoimmune thyroid illnesses such as Hashimoto's and Graves' disease, hypothyroidism, and thyroid cancer. What's the relationship between all these diseases that are increasing at epidemic rates? I say the relationship is iodine deficiency. Over the last 40 years, our iodine levels have fallen over 50%, according to the U.S. government's own studies. During that same time, we've seen rapid increases in all those illnesses I just mentioned. And I say that we're not going to get to the underlying cause of these problems with more mammograms and more PSA tests. We're going to get to the underlying cause when we start asking the right questions. Why are so many people suffering with thyroid, breast, and prostate and ovarian and uterine problems? And I say it's nutritional and hormonal imbalances, and one big piece of this puzzle for all this stuff is iodine deficiency. I've been looking at patients for 20 years and trying to help them achieve their optimal health. And I can assure you it's impossible to achieve your optimal health if you don't have a properly balanced hormonal system. And I can assure you it's impossible to have a properly balanced hormonal system if you don't have enough iodine. Iodine's concentrated in all the glands of the body, and that includes the thyroid and the adrenals and the ovaries and uterus. And I'm repeating myself with these, but it's important because so many people are suffering from these glandular problems. And most people don't know that if you don't have adequate amounts of iodine, you can't make any hormone in the body. That not only includes the thyroid, that includes the adrenal hormones. And a lot is written about low adrenal problems, and people need adrenal support, and the adrenal glands are your fight or flight glands, and you need proper adrenal hormones to feel good and to be able to exercise and to be able to just function daily. Well, I can tell you, I see a lot of people with adrenal and thyroid problems, and they can't get their balance if they don't have enough iodine. Now, the government fortified salt with iodine in the 1920s after recognizing the goiter epidemic that was affecting the United States. And that little bit of iodine in iodized salt, it's about 75 micrograms per gram, was enough to prevent goiter in the vast majority of people that ate iodized salt. However, what's happened in the recent years is our exposure to toxic chemicals that pull iodine out of the body has increased rapidly. And two of these toxic halogens are fluoride and bromide. And we get bromide. I found that bromide toxicity occurring in every single one of 1,000 patients that I've tested for the bromide levels. And in fact, I stopped checking people for bromide toxicity just because I thought I was wasting their money, because everyone's high in bromide. We are exposed from bromide from multiple sources, from simple things like if you're in a pool or a hot tub that has brominated, where they're using bromine to keep the water clean, there's one exposure. But we're getting bromide in our food from bakery products because the government allows flour to be brominated instead of iodinated. So the breads and pastas and cereals made with regular flour have bromine in them. We also get bromine in drink, such as Mountain Dew and other soft drinks. And we get bromine in a lot of medical prescription items, such as inhalers for asthma and other prescription items where there's a bromine atom in the center of the drug. The next most common halogen that is causing problems with our iodine levels is fluoride. And we all know that our water supply is fluoridated, even though there are no good studies that show the fluoridation of our water supply decreases cavity rates, which is why they did it in the 1950s. What's not known by most people is that almost every single European country that used to fluoridate the water has stopped because they've realized that fluoride in the water is more dangerous than it is helpful. And they've also realized that there's no difference between cavity rate in fluoridated versus unfluoridated countries. We also get fluoride in juices and any canned food source where they're getting it from a public water supply and using that water as part of the canned juices. It's in baby food, and we have become an over-fluoridated country. And this double whammy of fluoride and bromide has really pushed the iodine levels down in our body and made us worse. And the consequences of this are this epidemic of breast cancer, fibrocystic breast disease, thyroid cancer, autoimmune thyroid illness, hypothyroidism, and prostate cancer that we're seeing. And I firmly believe that we're not going to get to the underlying cause of these problems by ordering more tests, such as mammograms or PSAs these diseases are certainly not occurring because we have a deficiency of surgery or chemotherapy or radiation out there. It's occurring because we have nutritional and hormonal imbalances. And one of the biggest nutritional imbalance is iodine deficiency. I've tested over 6,000 patients. Well, between my partners and I, we've tested over 6,000 patients. We found over 96%, our numbers right now are 96.4% of these 6,000 patients are deficient in iodine. These are huge numbers. The majority of those 96% are not just mildly deficient in iodine, they're severely deficient in iodine. So if iodine is supposed to maintain the normal architecture of the glandular tissue, you can just think about what's happening to these 96% of patients who have low iodine levels. You can think about what's happening in their thyroid, their prostate, their ovaries, their uterus, and you can gather that there's going to be illness in those tissues. And until that is being identified by the powers that be, we're just going to keep rolling down the same pathway of spending too much money on diagnostic tests, too much money on therapies that don't treat the underlying cause of the illness, and we're not getting to what's causing the underlying cause of many of these illnesses. And we need to really revamp our approach. And our approach should be to search for underlying causes and nutritional and hormonal imbalances, and to really search for what's throwing off the biochemistry of the body that's allowing these diseases to develop. And really, when this search begins, things like there's more than just iodine out there, and I don't feel that iodine should be used solely without it being used as part of a holistic treatment approach. So yes, iodine can help all these conditions, but remember, if the listener decides that they're going to take iodine just from hearing me talk, you're going to displace these fluoride and bromide atoms that are all through your body, and your body has to get rid of those, mostly through your kidneys and through the urine. And if you don't have the proper nutritional support, you can cause some problems with taking iodine. Well, the biggest thing that you could take to prevent the detox reactions from iodine is salt, unrefined salt. So in the old days when people got bromide toxic, because the medical establishment used to give people bromine because it dulls the brain. So if people were having mental issues, they would give them just bromine to just chill them out. So in the old days when they gave too much bromine, how'd they get the bromine out? They used to salt it out. So they would give people sodium chloride IVs and oral salt tablets. Well, we don't have to use IVs of sodium and chloride to do this. All you have to do, if you're going to take iodine, the biggest thing I can encourage the listeners to do is to increase their intake of unrefined salt. And unrefined salt has over 80 minerals in it. When you compare that to refined salt, which has 0 minerals in it, the other things that help to prevent problems when taking iodine, number 1 is salt. Number 2 is drink enough water. You want to maintain hydration. Number 3 is vitamin C. Vitamin C acts like a strong antioxidant. And, a couple thousand milligrams of vitamin C goes a long way in this case. B vitamins are very helpful, particularly vitamins B2 and B3, but a good B complex could be helpful for this. And a major thing is magnesium. Magnesium can counter the problems that happen in the thyroid and the breast and the ovaries with too much iodine as oxidative stress builds up. And taking 100 to 400 milligrams of magnesium per day.
What about selenium? Because I've been told by a lot of folks that's key to also take along with the iodine.
There's numerous studies that show that selenium can help autoimmune thyroid disorders. Selenium acts as an antioxidant. Selenium can be a part of this plan and very much help prevent toxic reactions from iodine. And let me clarify that. I don't see too many toxic reactions from iodine. Most people, if they just do the basics, hydration, salts, magnesium, vitamin C, and a little B vitamin support, they won't get any problems when taking iodine. It is occurring at epidemic rates, and women should know, well, women and men should know, you can't get an autoimmune thyroid disorder unless you're iodine deficient. Unfortunately, conventional medicine is under the myth that iodine causes these illnesses. Well, if iodine were causing these illnesses, we'd see them declining over the last 40 years as our iodine levels have fallen over 50%. What's happened over the last 40 years? Autoimmune thyroid illnesses have increased in epidemic rates, all of them, from Hashimoto's to Graves' disease, and then we throw in thyroid cancer, all increasing while these iodine levels are falling. It's pretty clear what's causing this, and a big piece of this puzzle is iodine deficiency.